To our social hour. My name is Shiko Kaitani. Keep talking to us, engaging us through our social media platforms. You can catch us as at K24 TV across Instagram, Facebook, Twitter, you name it. The hashtag is K24 this morning. Also, please remember our WhatsApp number is pretty active and at the bottom of your screen should you wish to contribute to our ongoing discussions. Now, today we take an overview on the issue surrounding water supply in this country. Some may even refer to it as a crisis. And so we ask, what are the main causes of obviously the shortages that so many of us are experiencing? How does this go on to affect the health of millions of Kenyans today? My guests today say it boils down to water governance matters, and perhaps with their expertise, we may be able to summarize some of the main solutions proposed to this age-old problem. So, as we begin this particular conversation, it is my pleasure to have on the show Antony Ambugo, who is the CEO of Water Services Providers Association. Welcome to the program.
Thank you.
And we are also joined by Samson Malesi, who is the CEO of Kenya Water and Sanitation Civil Society Network. Welcome, sir, to the program.
A pleasure to be here.
All right. So remember, as always, we've got the question of the day. Let's throw that to you. We already teased it in the previous hour. We're asking, what more do you think the government should do to ensure safe water and sanitation is available for every Kenyan citizen? You may also go as far as obviously giving us your thoughts in regards to this discussion as to what are the issues facing water distribution in this country. If you have been affected year in, year out, why don't you also weigh in, share your experiences as well, would be most appreciative. Let me start off with you, Antony, on this one, right? You know, it has been described as a crisis, a water crisis that we are facing, so to speak. How dire is the situation, if you will, from obviously the data you've collected and through the work that you do?
Thank you very much. The crisis of water is not only a national crisis, it is an international crisis. And it is said the crisis of water is not about water itself. Yeah. It's a crisis of governance. And there is broad consensus that has been built internationally over time. Yeah. So if you want to fix water problems all over the world and in this country, you fix the governance problems.
Okay. Mr. Malesi, if you will, you know, there are people who probably will definitely relate to today's discussion because, you know, they've been born and raised with no running water, poor sanitation systems. Which areas would you describe are probably the worst hit in this country?
I think the water crisis cuts across, and I wouldn't point a finger to any one part of the country and say that this is a part of the country that is fully endowed and therefore not experiencing the crisis. I think the crisis cuts across, and because there are various elements of the crisis, as my colleague has mentioned. Yeah. There are areas facing chronic shortages. There are areas facing issues of quality. Yeah. There are areas who have the water but are also facing excessive pricing due to the challenges in terms of the supply or the kind of private supply that they are having. And therefore, it's a crisis that cuts across the country and manifests quite differently. Yeah.
Mr. Antony, how would you say that your organizations collaborate? You know, when you talk about the work that WASPA does, as well as KEWASNET, actually, if I manage to mention that right, how do your agencies collaborate?
Yeah, we work closely because you realize that under SDG number 17, in terms of collaboration and partnership, no single institution, no government, no nation can achieve or contribute to the SDG number 6 without building strategic partnership and alliances. And that is why we have come together with KEWASNET, because already there is a crisis that we are seriously facing in the sector. And this relates to payment of water bills.
Okay.
Because water is not like, it can't be free. Because different schools have always contested that water should be free. But this is what we say, is that if you look at Article 43 of our Constitution, it is succinctly clear that every citizen in this country has a right.
Right.
And that right is to safe and clean water. So there are parameters of safety and there are parameters of cleanliness.
Yeah.
So it is not water in its natural state. So to make it potable,
Yeah.
the way it is contemplated under SDG 6, because as a nation, we are committed to ensure that there is universal access to safe and clean water and safely managed sanitation. So you will find there is the cost of making that water safe in terms of chlorinating it. And if you go like Chania here, where Thika Water abstracts one of our members, the river is blood red. So you have to reduce the turbidity. What do? You have to bring in a substance called alum. So in that process, you find there is a cost involved.
Yeah.
There are employees. So what we do in the water sector, we say that we don't sell that water. We just ensure that the customer meets the cost of ensuring the water is safe and clean, because it is a right. So in that process, you will realize that once you get the water, the piped water, you get monthly bills. And I want to affirm to the nation that we still remain the cheapest source of clean and safe water in the country. Do you know a jerrycan of 20 liters we sell between 70 cents and 2 shillings at most?
Wow.
That's how cheap it is, the piped water.
Yeah.
But the problem, as my friend has said, is that where we don't have this access, especially the vulnerable people in the informal settlements, you can mention the Kibras, you can mention the Nyagachos in Kericho, you can mention Awelo in Siaya. You find that you will have water vendors.
Yeah.
And because they get it maybe from our point at 2 shillings and transfer it to places where there is no access to water, the price will triple, double, or even go to 10 times.
Yeah.
They can sell that jerrycan at 20 shillings.
Okay.
So the problem is now during this crisis, because you realize that we played a fundamental role as water services providers in terms of being the first line of defense during the inception or the start of the pandemic.
Okay.
And the government had to cushion its citizen because it had to ensure that everybody has water.
All right.
So there was a moratorium which was issued that we should not disconnect people who have outstanding bills.
Okay. Okay.
Interestingly, this was interpreted not to pay bills. So people are not paying bills. So what happened is that there was a dip in revenue. And that one brought now a threat to sustainability, because that bill that you pay is what you use to buy chemicals, pay electricity, and also pay salaries to the workers.
Okay.
We are not in any way supported by the government.
You're independent.
We are independent.
Okay, and if we can bring in Mr. Malesi, if you will, Anthony, you know, one of the big questions as we've been preparing for this particular program was just trying to understand about the kind of poor management, okay, like he had mentioned earlier on, so, you know, regarding water supply. What do you think is really plaguing agencies today so that I, as a Kenyan, can have access to that safe, okay, clean water? What is the issue in this country?
So there are a number of issues, and speaking to the broader governance issues. But before I dig deep into that, I would just say that the water service providers, we have two main categories. We have those who have been regulated under the national regulator, who are represented by my colleague here, the CEO. And then there is another huge group of, he mentioned informal service providers, but we also have the small-scale service providers who basically provide services within areas that are not reached by the pipeline of the regulated service providers. So when we look at the challenge in the water sector in Kenya, we have to look at it from this perspective, that there are those who are regulated, and there are clear standards which are defined for them. They are under strict regulation, and most of them aspire to reach those standards, albeit certain challenges. But we still have, actually, based on the regulator's report, latest report, the total population that is directly reached by the regulated service providers is about 15 million Kenyans. So what does that tell you?
Yeah, what happens to the rest?
Exactly. That the majority of Kenyans are either served by small-scale service providers or other non-regulated service providers.
Right.
So when we have this huge umbrella of unregulated service providers, there's a myriad of challenges, including issues of quality that he talked about, the cleanliness and safety of the services that they provide, issues to do with pricing, affordability to the consumers. There are issues to do with regulation about issues to do with pollution and so on. So there are quite a huge number of issues, but we have to look at them from these two categories, because those who are regulated, it's much easier to see and try to address those challenges.
Yeah, and even to track.
Yes, indeed. But those who are not regulated, it's a Pandora's box.
It really is. Yeah. Let's remind our viewers, gentlemen, about our question of the day. Remember, we want you to weigh in on our ongoing conversation, especially if you have been, you know, raised in a particular area, if you will, or currently residing in an area that has been seeing this age-old problem of water shortages. How has this affected you and your family personally, by the way? And we ask you, what more do you think that the government should do to ensure safe water and sanitation is available for every Kenyan citizen? Okay, Anthony and of course Malesi, let's see what Kenyans are saying via WhatsApp number. You can see it there on your screen. Someone says, I'm Captain Sankale from Karen. For years, our leadership from the past regimes have been announcing drought and famine a national disaster. Billions and billions of shillings have been used to help those affected. When the rains come, the government announces a disaster. When floods come, I ask, are we crying for our problems to be solved, or we lack minds to mitigate the issue of water? I ask, why, when, who? Anthony, please. Your feedback.
That is interesting. You know, when we had the Water Act 202 during the water reforms, what it did, it brought a new architectural framework within the water sector, where different institutions were created. So we are creatures, even the water service providers I represent are creatures of that act. So what happened when we transited into devolution because of promulgating the Constitution 2010, the act was repealed, and we had the Water Act 2016 to reflect the constitutional mandate of the county government, because now the county government had also a mandate in terms of water service provision. So we have the issues of infrastructure. That is what the gentleman is speaking about. We have the issue of water as a resource. One, water as a resource, if you look at Kenya, we are classified as a water scarce country.
Right.
We don't have enough fresh water resources to provide to our populace, because the requirement is 1,000 cubic meter per capita. And I think it is in 2019 we were at 452. Uganda is okay, it's above the threshold, and also Ethiopia is okay.
Right.
So that is one of the biggest challenges. So it behoves us as a nation in entirety, everybody, to protect and conserve the environment.
Right.
If we are destroying now our catchment areas. So that is challenge number one. Challenge number two is in terms of the infrastructure of providing. We are talking of the reticulation system. If you look at Nairobi, Nairobi Water provides water within this city, but it is not sufficiently covered.
Right.
Because one, Nairobi itself has no water source of its own. We are getting water from Dakaini, and we are getting water from Sasamua and Kikuyu Springs. And that's why when it rains here, you realize that this one is just like a floodplain. So that is one of the challenges we are talking. And investments in terms of water management, in terms of the storm management, which is within the purview of the county government,
Right.
and also investment in reticulation. One requires huge capital outlays. That one notwithstanding, I think the government is doing something. We are talking of the Northern Water Collector Tunnel, which is going to inject around, I think, 100,000 cubic meters.
Okay.
But that is not sufficient because
Yeah.
the demand in Nairobi, we are talking of 800,000 cubic meter per day. But the installed capacity is
Yeah.
around 585,000.
So again, investment.
So there is still a deficit.
Yeah.
Now, if you speak in terms of finances, you realize that you have a huge budget hole. To achieve SDG number 6, so that everybody has safe water and safely managed sanitation, we require around 1.6 trillion. But what the government can be able to raise in the next 10 years is around 500 to 600 billion.
So this dream may never be achieved.
So you realize there is a huge capital, but there are outlays, there are strategies that can be used. And you see, this is why in the water sector now we are looking for public-private partnerships.
Okay.
If the government alone cannot be able to do it, how do we incentivize the private sector to come now into water the way they have gone into energy? So that they can plug the deficit.
Malesi, would you describe the water sector as controversial? I mean, it's even termed as water politics, right? From the viewer's perspective, okay, or someone who's the consumer, what we understand is cartels, so to speak, that have taken over the supply, okay, in this country, or at least let me speak about Nairobi. You know, I don't know about other parts of the country, but what is the impact of these, because you describe them as small-scale distributors, correct? Are those the same people we can refer to as what we know as cartels to begin with? And what really is the impact of them in, in the game?
So cartels are a reality in the sector, and I don't think I'll be one to run away from that reality. But it is not true that small-scale service providers are necessarily cartels.
Okay.
I think there are small-scale service providers who are very well organized, they are structured, and some of them are really a solution to service provision. You know, in Kenya, we subscribe to the human rights to water. It is protected by the Constitution. It is aspired for within the Water Policy, the Water Act 2016, and indeed the Vision 2030.
Right.
Yesterday I was in Kajiado, and one of the things that came out is that on average in Kajiado County, the citizen in Kajiado County is basically accessing 7.5 liters per person per day. Under World Health Organization, that rate is what is provided for survival, basic survival. It is expected that at a minimum, someone should have at least 25 liters per person per day. So when you're talking about controversy, is why is it that we can have somebody and a majority, because that is average, 7.5 liters per person per day in Kajiado is an average. So that means that there are those who are getting maybe 2 liters.
Others are getting excess.
Yes. So the controversy is in the imbalance. The fact that we have not been able to assure every citizen of that regular supply, albeit the reality that, yes, we are a water scarce country, as it is, and it keeps on shrinking, actually. A few years back, we were at 641, and as my colleague has said, we are now, the latest report we have is 452 per person per year. So that is a shrinking level, and we must, as a country, agree on how is it that we have equitable but sustainable distribution. But it does not just start with supply. As my colleague said, we must protect the resource because it is a diminishing resource.
All right, yes. I understand that we have to take a short commercial break, but we'll be back with more. Remember, we are actually tackling what you would refer to as a water crisis in this country, and really asking for your personal experiences. Should you have been experiencing water shortages in your particular area? Here's our question of the day. Let me ask my director to just slap that up on the screen so that, of course, as we take that break, you can get texting. This is what we ask. What more do you think the government should do to ensure safe water and sanitation is available for every Kenyan citizen? More so, what is your take in regards to water supply in this country? What's really plaguing the water sector? Talk to us at K24 TV is how you can reach us. Our WhatsApp number at the bottom of your screen. We'll be back.